Does is it sees a vantage point of the heart and looks for two particular arrhythmias, which are cardiac arrest, ventricular fibrillation or rapid ventricular tachycardia. Big words, but what the device is doing is it's looking for the heart doing this, which is cardiac arrest. If you are not in cardiac arrest, or if you're like what we're all in right now, normal sinus rhythm, your heart is pumping blood and oxygen, your extremity is doing its job, this is the way it's supposed to be. Cardiac arrest isn't when your heart has stopped, or like you envision Grey's Anatomy, ER, Chicago Fire, like 90 other ones that are on TV now. You envision the flat time and they call the code and everybody comes in shocks and they jump off the table and stuff. That it's not real life. The AED is looking for cardiac arrest when your heart is fluttering and it's not doing its job. What it's going to do is see that, advise a shock, and deliver a pulse, a very strong pulse to the heart to stop it, to allow it to restart. Okay, that's important to know, and I cover that because I've had situations as of late where people are having chest pain, put the pads on. You don't want to do that. Okay, it's still not going to shock you when it doesn't need it, but it could cause confusion. Unresponsive, not breathing. I think I've harped on it quite a bit. Yeah. All right. So I'll go through it and show you what it does. The only thing I have to have you ignore for me is when I guess you're gonna hear beep. I use open pads. I was going to. I am now on purpose. So it's going. The AED is even smart enough to know when the pads are open. So you'll hear maintenance required. Just ignore that. It's because my pads are open. The other thing I'm going to do is I'll walk through the rescue and I'll plug in this box behind me. You'll never unplug the pads in a rescue. You let EMS take over care. I'm just doing that so you guys can see what a real AED looks like when you use it. So this is going to act just as any of these in the boxes behind me will. So it's unresponsive, not breathing. 911 should be called. Someone should start CPR immediately.
Maintenance required.
While this is on its way,
rescue. Stay
chest
calm.
compression should be
Follow
going.
these instructions. Make sure
When this
911
arrives,
is called now.
You can follow these instructions.
Begin by exposing patient's bare chest. Remove or cut clothing if needed. When
I'll come
patient's
back
chest
to
is bare,
at this
remove
point in
the
time,
white
if Eric's
square
helping
package
me,
from lid of AED.
he's doing this
Tear
while I'm
open white
pulling these
package
out, okay?
across dotted line and remove
So
pads.
I peel them and he continues to do
Firmly place the
CPR while
pad
I'm
without the
putting this
blue
on.
plastic on patient's bare chest, exactly as shown on pads. This pad can be placed on. Make sure pad connector is plugged into AED.
This is what happens in a real
Do
rescue.
not touch the patient.
At that point is
Analyzing
when
heart
you would
rhythm.
stop CPR.
Please
And I'll
wait.
come back to all this to explain why that's important.
Do not touch the patient. Analyzing heart rhythm. Shock advised. Do not touch the patient. Shock will be delivered in 3, 2, 1. Shock delivered. It is now safe to touch the patient. Give patient 30 rapid compressions and 2 breaths. Place heel of one hand on center of chest between
You do
nipples.
CPR if someone's there,
Place
they
heel
can
of
start
other
right away.
hand directly on
If you need
top
help.
of first hand. Lean over patient with elbows straight. Press the patient's chest down rapidly, 1/3 the depth of chest. Then release. Start CPR. Press, 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 press.
So I'm going to continue to do that.
Press, press, press.
Continue to do that, which is a
press,
daunting, very
press,
exhausting
press,
task.
press,
The device
press,
is going to tell me to give 2 breaths.
Press, press,
Right?
press,
So I hate to
press.
talk over it.
Stop compressions.
Give me
Give
2
breath.
breaths, and I'm going to go back and I'm going to continue the compressions and it
Give
says
breath.
start again. I'm going to do that for about
Continue with compressions.
2 minutes
Press,
approximately.
Press,
30
press, press,
30 compressions
press,
and 2
press,
breaths.
Press, 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 press,
And continue to do that until help arrives, until EMS gets there. The AED should be disconnected by EMS. It shouldn't go with EMS unless they have a dire need for it, unless they don't have their own equipment, which most in our areas, Ohio, Indiana, all do. Union City shows up, they're got a big old huge monitor, they're gonna start putting their stuff on, and they'll disconnect that, and it'll go back into service shortly thereafter.